patient education counselor, a chiropractor, a teacher, and that's Dr. Lynn Gerner.
And in the naked light I saw 10,000 people, maybe more. People talking without speaking. People hearing without.
I'm not supposed to start crying yet. I'll take 5 seconds away from my talk, and that song means a lot to me. I was so happy when Justin said that we could pick our opening songs because I was just listening to that song, and I shared it with Justin the day before, and if you listen to the words of that with that version, the disturbed acid rock version, that's a great song. Anyway, this is awesome. are my slides up there? Yes. So I am Lynn Gerner. I am from Davis, California. Some of you know where that is. That's right down the street from Sacramento, and I'm about an hour and a half east of San Francisco. And I got my start in the ICPA 22 years ago. I was a student at Life West, and I remember the day clearly. Those of us who are Life Westers can envision where I was. I was walking through the quad, down the hallway, and my phone went off. And of course I answered it, and it was no other than God herself, Jeannie Ohm. And, I was in shock at that point. And she asked me if I wanted to be the student proctor for the brand new, then it was the FICPA program, that's CACCP for old people. And it was their brand new location in San Francisco. And those of us who are from that area know that that's really industrial Hayward. So anyway, yes, I said yes, of course I would. And so for the next several years, I had that honor, and I got to host the speakers and go out and party with some of them. Armand Rossi, we've been joking about that memory. And that's what launched me in the ICPA. And I'm forgetting a little detail just because I happen to be nervous. Oh my goodness, I'm used to giving 8-hour seminars, but speaking for 20 minutes to you guys, my huge peers and mentors, is a little nerve-wracking. An important detail of that was that I was also a mother at the time. So I started chiropractic school a little later than the average bear. I was in my mid-30s. I was a single mother of 2 at the time. My youngest was only 18 months old. My students or people that went to school with me would remember him running around the hallways sometimes. And prior to that, I had been a graphic designer. So that plays into what I do now quite a bit, in that I am very right-brained and very visual. And so let's fast forward a little bit, 10 years after that, okay? I'm out in practice. I'm in Davis. I've got a sweet little family practice going, seeing a lot of moms, a lot of babies, a lot of everybody. And just like what Ian said, I started getting more and more phone calls asking about this mysterious tongue tie and asking if I worked with breastfeeding. And of course, what do we say as chiropractors? Yes, I do, okay? And at the time, I was very comfortable adjusting babies, doing spinal work. I knew enough to kind of mess with the jaw a little bit and maybe affect the jaw. But I also knew what I didn't know. And what I didn't know was very specific functional cranial work. I knew that I needed to go and be trained. So I did what every good pediatric chiropractor should do, and I went back to the ICPA, and I followed the amazing Dr. Martin Rosen around the country for more than a few years. And I took his course over and over and over. And I wish Marty was here, because I was going to try to do a little, tribute to him, because he is brilliant. So then what I did after that is every time that I went and took his course, I went back, and because I'm very right-brained, I dissected it, and in my brain, I'm like, okay, so the temporal bone goes internal, so what does that do to the sphenoid and the occiput, and how does that affect the tongue, and where are those muscles connected, and how does that affect the cranial nerves, and how is all of that affecting breastfeeding? And like Ian just said too, it's all anatomy. If you understand the anatomy, it makes so much sense. But not a lot of people in the medical profession think of it that way. So then again, I do what all of us chiropractors have to do, is I went out to get people to refer babies to me. And I'm usually willing to talk to anybody who wants to stand there for a while and talk to me. So I I developed about a half-hour presentation that I took on the road in my area, and I talked to our breastfeeding coalition, and I talked to lactation groups, and I talked to doula groups and midwife groups, and all of the dentists that were popping up all over the place doing these releases, the frenectomies. And anybody that would let me come into their group and speak to them, I did that. And you know what I realized in doing that? They did not understand what I did. And that's very true even today, which is why we're interjecting, or why we're starting these courses. So, lost my train of thought. Where are we? Oh, okay, cool. I have slides. Let's go to that. Anyway, the point that I'm trying to make in this particular moment is that even now, with general anatomy physiology, obviously, that the medical profession gets, they do not understand the basics of structure and function, and especially not neurobiomechanical structure and function. Also in that time frame, I became what's called a CLEC. That's kind of one step below an IBCLC. I didn't think I had time in practice. Oh, by the way, I'm in full-time practice too, to do all the IBCLC. But I went and got the CLEC so that I would have the education to have that necessary conversation with my patients. And once again, lactation consultants are not taught basic anatomy, definitely not infant anatomy. The LCs were coming to me, they were calling me, this still happens to me frequently, can I take you out to breakfast? And they ask me what's going on with the babies that they are seeing in their clinics, because they know that something is going on, they know that there's some sort of limitation on the side of the baby, but they just don't have the training to understand it, and they're definitely not allowed to address it. So, that's kind of a long introduction of me. And there we go. So I chose to call my talk The Gift and the Gravity. My cohort, Andrew, did a wonderful job, beautiful job on all the technical side of this. I want to talk a little bit about what it's like to actually practice in a breastfeeding lactation support practice, because that's primarily what I do now. Almost every single patient that I have these days is for breastfeeding support. So I called it The Gift and the Gravity because it's definitely both. It's not your average bear kind of practice. So first of all, the first gift that I want to talk about is, of course, that sweet little baby at his mom's breast. Now, I want everybody to close your eyes. I want you to envision the baby just so close and so warm, being held by his mom. And those of us who are mothers, we can remember our own children. And I want you to just see how warm and safe that baby feels. And I want you to hear the gulping noises as that baby is suckling and taking that perfect, absolutely perfect substance that his mother's innate knows how to create, that is just perfectly for what he needs. And hear that gulping noise. I love that sound. Smell what that smells like. And just really get a sense of how warm and safe that baby feels. Okay, we can open our eyes. That's a gift. That's an absolute gift. Beyond the science of the nutrition and the neurological benefits, which Andrew and I will go into our class for sure, what I want to really impart here is that in that moment, the baby's brain is being imprinted that life is good, that it's safe. Other speakers here today have talked about the fear that we're imprinted with in the age of COVID. All of us parents know what our children are up against in the coming generation. You know, they are assaulted chemically, emotionally, and again, think about masking, social distancing, the fear that our children are being raised with right now, that they have to be afraid of their own bodies, that they're afraid of some invisible danger around them. Being imprinted with that feeling of safety and that life is good, that's a game changer in life. So that's the first gift that I want to impart. Now, let's go to a gravity, okay? In this type of practice, we are meeting the mother at her absolute most vulnerable time in her life. This takes more than the average visit. She's just given birth. She's probably trying to heal from a traumatic birth. She may have just had a C-section. If her baby's not feeding, she's not sleeping. She desperately needs to heal at this moment, but she can't. She may even be close to clinical depression. So this requires us to really give so much of ourselves and to have a broader knowledge base as well to help with these scenarios. So this is sometimes a challenging conversation to have. Here's a gift, okay? It's obviously, we all know how sweet it is to lay our hands on a sweet little baby and to remove subluxation. The baby is always just ooey gooey, happy, right, Andrew? They never cry? Where are you, Andrew? We talk about this all the time, like, oh my God, like I saw 20 babies that just screamed in my face today. Okay. And that's more like what happens, okay? I don't have time right now. I actually have a audio thing of I was gonna have a screaming baby in the phone for you to listen to for a couple of minutes. But more often than not, the baby is not happy. It is wired and tired and overstimulated and maybe constipated and definitely in sympathetic mode. And guess what? If that parent is also at their wit's end, guess what? Yeah, guess what happens? That stress level goes up. Okay. So again, it's a lot to maneuver sometimes. Sometimes we have to take a break. Sometimes we have to learn how to do it differently. I know my male counterparts in the room may not be able to do that. I do that all day long. It's such a sweet way to, again, the baby's safe, happy at the breast. The point is just that we have to adapt. We have to make a lot of, we just have to be flexible. And again, we'll talk about this in our course more, okay? And of course, there's always more going on. We all have pictures that we could share about this. I have a dog in my office all the time. These identical twins, one was getting adjusted while the little brother was playing with the toys. And this is not your 5-minute visit. Get them in, get them out. This takes a lot more attention and compassion, okay? So, oh my gosh, I only have 3 more minutes left. How could that have happened? Okay, so gift, the doors are wide open. I won't go through all of the study. We will go through this and other ones really in our class that validate the reason that chiropractic adjustment is so important. But ABM statement, even the medical doctors are acknowledging the overdiagnosis and the over-surgical approach to posterior tongue tie. They are looking for us to bridge this gap. I get calls all the time. I get emails looking for doctors in certain areas, chiropractors that know how to do this type of work. It is an open door, and we're standing on a precipice of this specialty work at the chiropractic office. And there's a short window of time. Okay, again, in 2 to 6 weeks, if breastfeeding function is not sustained or is not improved, if feeding is not achieved, mom's supply tanks, baby learns abnormal feeding habits, and emotions just dry up. So we have to be skilled, we have to be able to deliver the goods in a relatively short period of time. So once again, the door is wide open. We are being watched by the medical community. The door isn't completely open and accepting, but it is getting there. And that's what's so exciting about starting more and more of this type of focus and training in the ICPA, because there truly is such a huge need for us chiropractors to be able to do the very specific work that these babies need. I love this quote. This is from an article that many of you probably are familiar with. I believe it's Jennifer Toe, and I can't see my notes. I thought it was going to be up there. Who is that? Sharon Valone, yes. This is a great article to have in your toolbox about the benefits of IBCLCs and chiropractors working together. And I pulled this one little nugget out to share. If I can read that, I don't have my glasses on. The very possibility of restoring the competency that forms the foundation of all loving human relationships is a worthwhile goal by all accounts. All loving human relationships. 0. I'm going to say one more thing. Whether or not that baby has a tongue tie, whether or not there is feeding dysfunction, this is our opportunity to get our hands on these babies. Our scope of practice is simply removing subluxation that is interfering with the nervous system, with life force. And if that comes by the way of us receiving these referrals because of feeding dysfunction, because this is becoming a more accepting part of practice, then I think that is a fantastic thing. Thank you very much.